So I'll just ask Kathi to start, and if each one of you would introduce yourself, where you're from, and your the tool that you'll be speaking about, and then take your 5 or 6 minutes.
Oh, good. Don't start the clock till I finish introducing myself. I'm Cathi Mooney. I'm from the University of Utah. And can you hear me? I don't hear myself. I'm from the University of Utah and the Huntsman Cancer Institute. And my focus today is an exemplar of technology-aided support for family caregivers in the care of their family member. So we had a great talk this morning, and throughout the afternoon have really done a good job of bringing in the toll on family caregivers, as well as we always acknowledge the meaningful benefit of providing care to family members, but the toll that it extracts on caregivers. And it's in two ways. Sometimes there is talk about how the stress involved in taking care of the patient and what skills are needed to do that job. And secondly, a toll on the health and the well-being of the caregiver. And so this particular exemplar is going to be one that tries to address both of those areas with the same technology-aided tool. So this is some data, there's plenty of other data from one of our studies that relates when you are monitoring the well-being of the caregiver in terms of fatigue, anxiety, disturbed sleep, depressed mood, and interference with their normal activities. The vast majority of cancer family caregivers indicate that they were bothered at moderate to severe levels for all of those. So my example is a platform we developed called Symptom Care at Home. This is an example that I'm talking today about the application of it in home hospice care and how we can remotely monitor how families are doing at home during hospice care and then intervene to help them first in an automated way and then secondly in a stepped intervention to use provider time in an efficient way when symptoms or concerns continue beyond an acceptable threshold. This platform is also modifiable. So what you choose to monitor, what thresholds you set, what kind of coaching you give family members is totally changeable. But the example I'm giving is a study that we did in home hospice settings. This was a randomized controlled trial of 332 families providing home hospice care. It had a national sample of 11 hospices in 4 states. They were about half and half nonprofit and profit hospices. So there's 3 components to Symptom Care at Home. One is the automated daily monitoring of common patient symptoms, and then we also added 5 indicators of caregiver well-being. And we made it a very simple system. It was a call-in by the family caregiver provider, and reporting on how they had done and how the patient had done in the last 24 hours. Based on extensive algorithms, we provided just-in-time, tailored, automated coaching based on the severity levels reported first for the patient issues to coach the family caregiver on how to make the patient more comfortable. And then secondly, we also had coaching on family well-being, if they hadn't slept well, if they were anxious. And so they received that coaching. It takes about 11 minutes on average per day to do the assessment plus receive the individualized coaching. And of course that varied depending on whether or not they had many symptoms or not. There is also a provider alert that can be sent. In this study, it was sent to the hospice nurse that provided a dashboard of the family's responses when the symptoms or concerns exceeded the threshold that was set. In this study, the threshold was around moderate to severe symptoms because we wanted the hospice nurse to intervene early to decrease that before it escalated. We didn't tell the hospice nurse what to do. We let them use their best practices on that. And they could identify whether they were going to do watchful waiting or call the family or plan a visit. So we found that the system had significant benefit for patients. So it was a system that it supports family caregivers to be more effective in their care. There was significant less symptom severity. And when we looked at days, they would report a patient's symptom, 1 or 11 of them, didn't matter. One would trigger it. Moderate to severe patient symptom days were reduced by 38%, as opposed to usual hospice care. And I think that's an important thing, because when we started this study, I thought, well, you think of hospice care as the best place organized to provide symptom management to patients. They also identify their care as care of the family, including the patient. But yet we achieved additional improvement based on using the system. There was also significant benefit for the family caregivers in those 5 areas of well-being. There was actually a 51% reduction in the number of moderate to severe symptom days compared to usual hospice care. And an important factor we found is that the platform reduced, when the caregiver symptoms were reduced, it also benefited the patient's symptoms. Thus, supporting the caregiver is a twofer. It benefits both the patient and the caregiver. And we also found that 6 months after the patient's death, that the symptom care at home spouses showed much better bereavement outcomes than usual hospice care spouses. This is one of my favorite graphs that shows, although it's counterintuitive. So you see the line going up, which doesn't mean more vitality, actually means less vitality. But we like to look in a positive way. And we found that symptom care at home helped family caregivers to be resilient. And so what you see, the blue line, is the symptom care group, and you see how they were able to maintain their vitality throughout providing home hospice care, whereas usual hospice care families, it was just escalating burden for them. And we found that it also improved caregiver mood significantly as well. I provide these because this is what the caregivers told us about the intervention. Often I get people who say, oh, but it's so impersonal, and why would you do that? At end of life is not the time to use an automated system. But they bonded with the system. In fact, when I first looked at some of the interviews, I thought, well, they must be talking about the hospice nurse. But no, they were actually talking about the symptom care at home platform. So this is a sample of some of the comments they had about it. So symptom care at home, as an example, is a platform that is technology aided and helps patients through their family caregivers by giving them just-in-time tailored coaching, and also is a stepped intervention where first we try an automated approach, and then secondarily we contact providers in order to intensify care. Thank you.